Hello, my name is Lauren Oxendine, and I am going to be doing my recording on methadone. I am currently trying to share a screen recording that I have created with a PowerPoint view all at the same time. So I hope that this is going to be successful. I will begin by discussing some of the questions that we have been presented with from our teacher. So initially, let me just give you some background information on methadone. It's very interesting to kind of research and learn about how methadone works, why people use it, and how kind of it has been successful. So methadone is a medication that kind of does a dual function. One, it is a pain relieving medication, but at the same time it also treats with substance abuse. A lot of people who are addicted, kind of their final resort, I would say, is turning to methadone. So methadone can also be known as dolphin. That is kind of what it's primarily known as. And then some other people who may use it in more of a treatment setting refer to it more as methadone. And there are different maintenance programs that you can use for that. So a little bit of background information. Kind of how is addiction related to substance abuse. So the continued use of substance abuse is ultimately what resides into new consequences, which unfortunately is addiction. So as we transition into the next step of helping our clients after they have identified that they are addicted to the substance, we want to suggest some type of treatment. I think that I would also encourage ongoing counseling and outpatient therapy, as well as some other additional treatment services, whether it be inpatient, outpatient, and that kind of thing, to get them some assistance. Sorry about that, just trying to get all of my materials together to share at the same time. So, as far as a medication class for methadone, it is known as an opioid narcotic, and which is different than other aspects as far as antidepressants and those kind of things. So when we kind of consider exactly how does methadone work, the purpose of the methadone is to go in and fulfill the receptors. So they're ultimately blocking the receptors from the triggers that are constantly encouraging a person to use. So if a person is able to maintain on methadone, then they will be much more successful by decreasing other uses of substances. So usually it does take a little while for methadone to really set in and begin to block those receptors. It could be up to 30 days of just methadone use by itself. But the ultimate idea is that the receptors in the brain will be blocked by the methadone. Over a long period of time, those receptors will become blocked, and kind of I explain it to a lot of patients like blocked as in like this is your open receptor. So there are constantly triggers coming in, constantly, thoughts about using anything that may cause a person to use. Constant use of the methadone will come in and block that, as long as that person can withstand from using illicit substances along the way. So how quickly can a client expect to notice results? Well, this can vary for different clients. Instantly after taking the methadone, within a couple hours, I would say within 2 to 3 hours, a person will notice that they may be not as shaky, or they may be not as antsy for their next use. However, once the methadone has a buildup in the body, it will prolong itself for about 24 hours once you're stable on it. Then ideally that would take you over to your next day's dose. But as far as how often would a person need it, every day. However, over time, you know, the shakes, the sickness, the withdrawal symptoms will decrease themselves. In discussing what side effects that a person may experience, unfortunately, methadone is a drug that is somewhat of a band-aid for addiction, depending on which way that you look at it. Unfortunately, methadone can be addictive. So in that aspect, a person can still experience withdrawal symptoms from methadone. And one discussion that we recently had in the class, which was very interesting to me, was pointing out the difference I discussed in preventive versus kind of like a relapse. So methadone is not the cure-all for addiction. However, it is a preventive method for a person who is addicted. So for someone who is addicted, we can go at it from two different angles. Either one, this person can be monitored and be seen by doctors and nurses and staff at a facility, or they can be out on the street using. They can come to a treatment program and know exactly how much of a dose that they are getting in one day, versus going out on the street and taking as much as they can get their hands on. So that is kind of a difference there, and just being aware. So personally, I believe that methadone is a method to help people and to help save lives. There are so many people that overdose on a daily basis from illicit substances that, had they been in a treatment program where they could have been more closely monitored and educated and just kind of more involved in that process of recovery, then they may not have experienced those things. Some side effects that people can have the idea to expect, just like I said, they can feel all withdrawal symptoms once their medication is decreasing. And ultimately, a person should be encouraged to find a dose that is going to eliminate their withdrawal symptoms. Unfortunately, methadone can create a high feeling for an individual if they take too much. So there has to be some type of compromise, which I encourage blood work to be done to see exactly what is going on chemically with that person. A lot of times people are told, it is what the patient says it is. But in a circumstance like this, we have to understand that these patients are already in a routine of being manipulative and a routine of wanting more because more is considered better, whereas methadone in this case would be used as recovery. In regards to certain medications that can directly impact methadone, first it would be alcohol. Alcohol and methadone are extremely deadly put together, along with methadone and Xanax. So Xanax and alcohol have the same effect on a person as far as slowing down their heartbeat, slowing down their breathing pattern. Methadone also has that same impact on a person by slowing down their body functions. So the concern with Xanax and alcohol mixed with methadone would be that they fall asleep and then they do not wake back up, in which there have been multiple cases where that has happened, because usually an addict does not know how many Xanax will cause that effect while taking a prescribed dose of methadone. Another concerning medication to take with methadone is buprenorphine. A lot of people get these two things somewhat confused because they do react in the same manner to a person. However, buprenorphine is a little bit newer than methadone. They say that it is a little bit safer for a person. It still does work for illicit substance use. However, methadone is targeted more at heroin usage, and buprenorphine is targeted more towards pills and those kind of drugs that can be excessively taken to be addictive. Why those two things are have such a toxic combination is because they react against each other, and which could cause a person to go into instant withdrawal symptoms within 30 to 45 minutes of taking the buprenorphine after the methadone. Another question that we have posted here is blood testing required for methadone, which was my choice. No, it's not required at every treatment facility. However, I would encourage it to be, because you're able to see how the body processes the methadone once you're doing blood work. So a person is able to go in, after a certain amount of hours to see how well is that dose breaking down in their body, and their body being able to process that. Because without that, it is said that people, when they have too high of a dose, they will fall asleep. So they do encourage the client not to drive themselves, more than 30 minutes after taking methadone, because it could cause a sleepy side effect. Risk of discontinuing methadone on your own is extremely dangerous, simply because your body instantly, begins those withdrawal symptoms. Ideally, if a person is ready to come off of methadone, they will do a taper. So if a person is on 100 milligrams daily of methadone, the doctor may prescribe to drop down 5 milligrams a week. So your body is still getting that medication and still having those same effects of keeping the withdrawal symptoms off. However, you're not drastically decreasing or eliminating methadone at all, because ultimately you go in the reverse of the progress that you've made in saying that, okay, I've taken 90, now I'm going to drop down to 80. Your body is instantly going to be able to see that 10 milligram different change, and your withdrawals are going to be able to, begin much quicker. And of course, that's an uncomfortable feeling that nobody wants to feel. So I would not recommend discontinuing methadone without consulting a doctor and continuing ongoing therapy, because in the process of discontinuing any medication, there does have to be some type of awareness that the client is exposed to, because usually clients just feel like they can come off of methadone without any type of reaction to the medication, even though methadone is addictive itself. So I just would like to, kind of have that conversation with the clients to be aware that there will be some discomfort. However, the slower the taper, the better. Is there any risk of overdose with methadone? Yes. Just like any other medication, like I said before, methadone can be addictive, especially for long-term use. And taking too much can do the same effect as overdosing on opiate pills or anything, any dose, heroin, really anything. The first signs I would say that a client should be aware of is falling asleep. That would be the initial point. If you can keep a client in the office long enough for about 30 minutes to kind of see how it processes in their body, to see if they're instantly falling asleep or if they're able to maintain having a conversation and be able to function throughout their day, is the goal. So if they're unable to do that, that would be a red flag to me initially, because they are instantly falling asleep, which is a prime indicator that their medication is too high. So I think that I've covered all the questions that have been presented by the teacher. I also have some additional information just from the PowerPoint that I put together. So just a little bit more information on methadone itself. It was originally created in Germany, 1964. So I think that it's, worldwide at this point. It's not just the U.S. that utilizes methadone. There are different forms of methadone. So just like I said, you can take methadone in a liquid form, or the generic, which is the dolafine, which does come in a pill form. And just a little background on statistics. Currently, 23.5 million people that are 12 and older are addicted to a medication. So it could be liquid, it could be pills, it could be prescribed medication, it could be, something that they're buying on the street. But for 23.5 million people, it seems as though there needs to be some type of more closely monitored program, along with some better treatment efforts to get people off of these medications, especially when they are short-term medications. That is their goal. They are not meant to be long-term. So just like I discussed earlier, how does it work? So in the brain, it is obviously eliminating the cravings or decreasing the cravings. So it may not eliminate them completely, however, it would decrease them by the receptors being blocked by the methadone. And I think that another main point for methadone is that it creates an opportunity for the client to experience stability. Most clients have been using illicit substances for a very long time by the time that they decide to try methadone. So that alone says that it's pretty much a final stop for addiction. In regards to what it does to the body, when a person experiences withdrawal symptoms, they do experience sweating, seizures, hallucinations. Not all the time, but it can happen. Vomiting and being sick, those are the preliminary withdrawal symptoms. So when a person begins taking methadone, they usually say that it's about a year program. And I think that gives the accountable time for a person to build up to find their stable dose, as well as maintain for, maybe 9 months, and then taper off for a few months again, so that it's nothing that is instantly traumatizing to them. As previously discussed, so treatment, I think that is one of the biggest things that counselors and therapists could be pushing for a client who is ultimately struggling with addiction. Because even if we know it and we are not trying to assist in any way, I feel that we do hold some responsibility in that aspect. I think that initially it would start off with outpatient counseling and identifying goals for the client. So after the goals, and the client can identify their own goals, we should help towards getting them stable so that they are able to push forward with completing their goals. Ultimately, the idea would be to get them back to a productive lifestyle in society. Often, adults who have been working and have fallen into the addiction realm have lost their jobs, or have, had their children removed from them. So they are unable to get themselves out of that cycle without assistance. And so the first thing would be treatment. So just a little pros and cons about methadone itself. I would say a pro is that, hopefully it eliminates all illicit substance use, which is an important factor in the client getting drug screened on a regular basis, just to have a clear, open mind about what are they using, how frequently are they using it, because methadone cannot be as effective as it should if a client continues to use illicit substances. Ideally, it would reduce overdose. Again, that goes back to using other resources such as blood draws, urine screens, and those kind of things to ensure that the client is doing what they should be doing. Improved stability, just to kind of help them get back on their feet and have some type of recall of what it was like before they became addicted, which could create some type of motivation for a client as well. A con for methadone is that it is very addictive. It's not a long-term final fix. Sorry, not a long-term final fix for for substance abuse, but it is a stepping stone. So we just want to advise the client to not become addictive or not addictive, to not become reliant upon methadone as a healing aid for addiction. Another con is that it could not be medically monitored, being that some doctor's offices may just write the script and send them on about their way. Like I discussed earlier, a lot of substance abuse users are very manipulative, have figured out ways to get around the system so that they are able to, get what their addictive mind is telling them to get. It could create a lack of interest in detoxing, because people do feel like, oh, I'm healed, and I can just take my methadone and be perfectly fine for the rest of the day. However, your body will get immune to that current dose that you are receiving from the doctor. It may not happen quickly, but eventually the person's body will require more, just as the system is with substance abuse. And at that point, the client would want to go up on their dose versus finding a stable dose and then tapering themselves down and preparing themselves along the way to what they should be experiencing once they are off of methadone. And finally, it does have a negative stereotype. A lot of people are ashamed that they receive treatment for substance abuse. However, people need help in all areas. Some people need help with their blood pressure. Some people need help, with a variety of other diseases, bipolar or anxiety. So this addiction is just one disease that people do need help with. So I think that being more open to discussing the pros and the cons about methadone would help people to understand and to be more open-minded regarding how it can be helpful and, how we can help as counselors and therapists to setting them up for success. And that is all that I have for my presentation for methadone. I appreciate you guys listening to my video and giving me any feedback that you may feel is necessary. Thank you so much.